Hello everyone, welcome to our channel today. In this video, we're going to talk about the first interior warming formula, Li Zhong Wan. Li Zhong Wan was first recorded in Sanghan Lun. Let's see the ingredients of Li Zhong Wan. Li Zhong Wan, the first one is Ginseng, Ganjiang, Gancao, Baizhu. There are 4 herbs in this formula, and we can modify them according to the patient's condition, such as if the patient feel like, if the patient tell you they have the jumping feeling in the abdomen, they feel the pulsing feeling in the abdomen, we will remove Baizhu, we will add Guizhi. If the patient vomiting more, we will remove Baizhu, we will add Shengjiang, the fresh ginger. If the patient diarrhea and vomiting, we can keep Baizhu, we still add Shengjiang. If the patient have distending abdomen, have the feeling in the abdomen feel distending, we can add Fu Zi to Li Zhong Wan. Actually, when we add Fu Zi to Li Zhong Wan, it will become Fu Zi Li Zhong Wan. It's another formula we're also going to discuss in this video. The main function of Li Zhong Wan is to warm middle jaw, to warm the stomach, and it also has the function to tonify spleen. So the symptoms of Li Zhong Wan, the patient may have diarrhea, not thirst. The patient don't feel thirsty. The patient may be vomiting, nausea, or the patient may have abdomen pain. The patient have poor appetite. The patient was bleeding in different area of the body due to yang deficiency. We also can use Li Zhong Wan. So Li Zhong Wan is actually a formula to use for different conditions due to yang deficiency, especially due to spleen yang deficiency. There's another formula we're going to discuss in this video. So in this video, we're going to discuss Li Zhong Wan, Fu Zi Li Zhong Wan, Li Zhong Hua Tan Wan. These 3, because the ingredients of them are very similar, they actually the Fu Zi Li Zhong Wan and Li Zhong Hua Tan Wan actually modified Li Zhong Wan. So Fu Zi Li Zhong Wan is Li Zhong Wan add Fu Zi to make the formula warmer. Li Zhong Hua Tan Wan is we use Li Zhong Wan to add Banxia Fulin. It becomes Li Zhong Hua Tan Wan. Li Zhong Hua Tan Wan is to the patient have Tan is the phlegm. So in this condition, the patient have the cold condition in the spleen, and also the patient have phlegm due to spleen deficiency. Li Zhong Wan is a pill. So, but in Sanghan Lun, with these 4 ingredients, you have the name of Li Zhong Wan, Li Zhong pills. In the other books, also written by Zhang Zhongji. It's actually the same book, but due to the history, due to the war, the book was separated into 2 books. So the first one was Sanghan Lun, the other one was Jingui Yao Lue. These 2 books are from the same author. Actually, it is one book in the first place. In Jingui Yao Lue, with this ingredient, Ginseng, Ganjiang, Baizhu, Gancao, the same ingredients, they have the other name of Ginseng Tang. Ginseng Tang is ginseng decoction. Why they have different names of same ingredients? It's actually because in this formula, it depends on the condition. It depends on the patient's condition. It depends on which herbs you use as the main herb. if you use the ganjiang as the main herbs, it means the patient have internal cold condition. The internal cold, the spleen stomach cold condition is dominant. So we will use ganjiang to warm the body, to warm the stomach, to warm the spleen. If the patient have the yang deficiency, such as spleen yang deficiency, so in this condition, we will use Ginseng as the dominant herbs. So it becomes Ginseng Tang. Li Zhong Wan is generally being used to warm the internal, to warm the spleen. So the patient have the spleen yang deficiency, or the patient have symptoms due to spleen yang deficiency, we can use Li Zhong Wan, such as the patient may have poor appetite, maybe nausea, maybe vomiting, or the patient may be bleeding due to spleen yang deficiency. We also can use Li Zhong Wan. The patient also may be diarrhea. It depends on the tongue and pulse. So for Li Zhong Wan, the tongue, we will see the color of the tongue is pale. Sometimes have coating or may not have a coating, but the tongue must be pale. The other very typical symptom we're going to mention here is the chest pain. Sometimes the patient have a chest pain. For chest pain, we need to be careful it is due to the heart or not. If it's due to the heart, for chest pain, in Chinese medicine we call it 胸痹. 胸痹, the chest pain, there's two very different treatment principles. If the chest pain is due to the heart condition, we use the formula for the heart condition to improve the heart yang or to relieve the blood stasis in the heart. So for this condition, we will use the formula for heart problem. But there's the other chest pain due to spleen yang deficiency or spleen cold. It's actually the patient has chest pain due to the cold condition in the stomach. The cold condition in the stomach can cause the blockage in the stomach area. So the organs, especially for food organs, we need them to move smoothly. Once they block somewhere, it will cause the pain. So in this condition, if the patient have the chest pain due to stomach cold condition, we also can use Li Zhong Wan. In this condition, the patient also will have pale tongue, white coating, and the pulse may be weak, may be slow. For the chest pain, we will use the decoction instead of using the pulse. There's one thing we also need to be clear is that the ginseng in Shanhanlun is not the ginseng we are using now. So it's neither American ginseng or North Korean ginseng. The ginseng in Shanhanlun, it have the function to tonify the yin, to tonify the yin deficiency, also can tonify qi deficiency. So the property of the ginseng is not as hot as Korean ginseng. And nowadays we also can, if for a common condition, for not very severe condition, we also can use dampness instead of Ginseng. These are the main function of Li Zhong Wan. So when we know all these reasons behind Li Zhong Wan, it's easy for us to understand Fu Zi Li Zhong Wan. Fu Zi Li Zhong Wan is Li Zhong Wan at Fu Zi, because the patient have more severe cold condition in the stomach. So the patient have the distended feelings detending feeling in the abdomen area. The reason for this feeling also due to the cold condition. The cold condition caused the circulation blocked in the abdomen. So the patient have the detending abdomen. We use Fu Zi Li Zhong Wan. The patient also may feel cold in hands, in fingers, or in their feet. They can feel cold with the pale tongue. And the last formula we're going to mention here is Li Zhong Hua Tan Wan. Li Zhong Hua Tan Wan is Li Zhong Wan used to clear the phlegm. Why the patient have phlegm? It's actually due to the spleen yang deficiency. The spleen deficiency will cause the phlegm, will cause the dampness. So Li Zhong Hua Tan Wan, in this formula, they use Li Zhong Wan, they add ban xia, they add fu lin. It's actually to treat the cause and to treat the symptoms. They treat these both aspects. The phlegm is due to spleen deficiency, due to the cold condition in the spleen or the stomach. So we use Li Zhong Wan to warm the stomach, to tonify the stomach. And the patient still have the manifestation of phlegm. So we use fu lin and ban xia to clear the phlegm directly. Fu lin also have the other function to clear the dampness. So it's actually, so this formula is used to treat the root and the manifestation. Thank you for watching our video today. For more information, you can visit our website. See you next time.